Today we're talking about something very important to everyone. Why? According to current data, most everyone will be exposed or infested with these microbes in their life, or they already are. So, briefly, let's look at the facts and what we can do about it. Lyme disease and co-infections is the topic. Lyme disease is a condition with many faces and symptom presentations, from joint pain, fatigue, fibromyalgia, hormone and emotional imbalance, to mental dysfunctions, and much, much more. Lyme disease and its co-infections can imitate several hundred ailments and disorders. It is not to be underestimated. A sad fact is, if a person strictly depends on standardized medicine to determine Lyme disease or its co-infections, or for treatment, you will find yourself very frustrated and disappointed, at least. Some die before they get proper help. I know, because I have over 30 years experience in this subject, and over 90% of cases that come to me for help come after exhausting medical options. Let's talk about what is a co-infection. In microbiology, co-infection is the simultaneous infection of a host by multiple pathogen species. In virology, co-infection is simultaneous infection of a single cell by two or more virus particles. The most important tick-borne diseases in the United States include Lyme disease, Babesiosis, Anaplasmosis, Ehrlichiosis, relapsing fever, and tularemia. Rocky Mountain spotted fever, or also known as RMSF. Diseases that are acquired together like this are called co-infections. The main ones are Babesia, Bartonella, Rickettsia, Ehrlichia, and Anaplasmosis, and other co-infections. Let's break it down. First, Babesia is a malaria-like parasite. Babesiosis is a disease caused by Babesia infection. It is also called a pyroplasm that infects red blood cells. Scientists believe that Babesia microti is the most common pyroplasm infecting humans, but they have identified over 20 pyroplasms carried by ticks. In addition to transmission by the ticks, Babesia can be transmitted from mother to unborn child or through a contaminated blood transfusion. Currently, most blood banks do not screen donated blood for Babesia. The first case of Babesiosis was reported from Nantucket Island in 1969. Since the late 1980s, the disease has spread from the islands off in New England to the mainland. Cases are now reported across the United States, Europe, and Asia. Symptoms of Babesiosis are similar to those of Lyme disease, meaning severe, but Babesiosis more often starts with a high fever and chills. As the infection progresses, patients may develop fatigue, headache, drenching sweats, muscle aches, chest pain, hip pain, and shortness of breath, known as air hunger, which can be fatal. Babesiosis is often so mild it is not noticed, but can be life-threatening to people with no spleen, the elderly, and people with weak immune systems. Complications include very low blood pressure, liver problems, severe hemolytic anemia, which is a breakdown of red blood cells, or what we'll call RBCs, plus kidney failure. The Lyme Disease Organization at limesdisease.org stated, ticks in different geographic areas may be infected with one or more of the following Lyme disease co-infections: Colorado tick fever virus, Mycoplasma, Powassan encephalitis virus, the Q fever, Rocky Mountain spotted fever, which is Rickettsia by a different name, tick-borne relapsing fever, and other forms of Borrelia, plus tularemia. The tick chart to follow tells us where the diseases are found. We have not yet identified all the diseases that ticks carry and transmit. You can find more information about individual infections on their website, limesdisease.org. Bartonella results in a disease called Bartonellosis. Bartonella are bacteria that live primarily inside the lining of blood vessels. They can infect humans, mammals, and a wide range of white animals. Bartonella hensela causes an important emerging infection that was first reported in 1990. It is mainly carried by cats and causes cat scratch disease, endocarditis, and several other serious diseases in humans. Transmission of Bartonella bacteria are known to be carried by fleas, body lice, ticks, mice, which can transmit it to humans. Once humans are infected, it can be transmitted as easy as through bodily fluids. People with tick bites and no known exposure to cats have acquired the disease. People bitten by ticks have been co-infected with the Lyme spirochete and Bartonella. A recent study showed Bartonella can be passed from mother to unborn child, called perinatal transmission. Scientists have identified 15 different species of Bartonella. Sandflies in the Andes Mountains in Peru, Colombia, and Ecuador carry one type. Human body lice worldwide carry another strain, and European sheep carry Bartonella. Scientists have detected multiple Bartonella strains in California and across the U.S. Bartonellosis symptoms can include Bartonella rash, as viewed on the photo. Historically, Bartonellosis was described as a mild, acute, and self-limiting illness. However, more doctors have recognized that it can cause chronic infection. Patients may suffer relapses because Bartonella periodically cycles into RBCs, which provides a protective barrier from the bacteria. Early signs of Bartonellosis include fever, fatigue, headache, poor appetite, and an unusual streaked rash that resembles stretch marks from pregnancy. Swollen glands are typical, especially around the head, neck, and arms. Patients infected report more neurological symptoms and are more likely to visit neurologists than those without the disease. Other symptoms include blurred vision, numbness in the extremities, memory loss, balance problems, headaches, ataxia, and tremors. It sometimes triggers psychiatric manifestations. Bartonellosis diagnosis and treatment medically involves polymerase chain reaction, or known as PCR, and tissue biopsy. However, they are insensitive, just like the standard test. Dr. Breitswart, a professor at veterinary science at North Carolina State University, who has studied Bartonellosis extensively, notes that standard tests for it may be negative one time and positive another time, simply not effective enough. Although 2 strong antibiotics commonly recommended and at times successful, many doctors report needing to use several strong antibiotics in combination. Remember, when the bacteria is hiding in red blood cells, antibiotics do not work. Rickettsia are a particular troublesome bacteria. Found in lice, fleas, mites, and chiggers across the U.S., most Rickettsia infections are thought to be transmitted by ticks. There are 25 formally recognized species of Rickettsia, individually mostly in 2 groups. The spotted fever group, which consists of Rickettsia and Ehrlichiosis, and the typhus group. The spotted fever group, Rickettsia, or SFGR, includes Rickettsia rickettsii, also known as Rocky Mountain spotted fever, Rickettsia parkeri, and Rickettsia philippi, previously known as 364D, which was the cause of Pacific Coast tick fever. Rickettsia helvetica, also known in the U.S., which was discovered by Dr. Willy Bergdorfer in 1978, widely thought to be only in Europe. However, it was recently uncovered in Bergdorfer's 35-year-old archives that he had seen a bacterium that highly resembled Rickettsia helvetica inside the samples of blood-containing Borrelia, the Borrelia that causes Lyme disease. He called this microbe the Swiss agent. Rocky Mountain spotted fever, RMSF, is the most common rickettsial infection in the U.S. It ranges from a mild illness to a fatal one. Initial symptoms typically include high fever, severe headaches, abdominal pain with or without vomiting, and muscle pain. It often, though not always, includes a spotted rash that begins at the wrist and or ankles and spreads outward from there. RMSF weakens small blood vessels throughout the body, spreading its characteristic rash. This widespread damage to the blood vessels allows the bacteria to spread to the heart and the brain, and can quickly lead to death in those under age 4, or those over age 60, or those whose immune systems are compromised. Understanding a large and growing number of the population has a compromised immune system, most due to toxic chemical levels. Why? Simply, the CDC reported in 2018 that the average person in the U.S. is exposed to 15,000 toxic chemicals on a daily basis. Although hearing it, this is more than what most people can imagine. Rocky Mountain spotted fever, prior to the use of antibiotics, had a fatality rate of 80%. According to the CDC, today the U.S. fatality rate is 5% to 10%. However, in Mexico, just across the border, fatality rates are currently as high as 30%. I don't need to explain that growing risk, do I? Ehrlichia and Anaplasmosis ehrlichiosis is a term that describes several different bacterial diseases, currently 5 identified officially, one of which is also called Anaplasmosis. Some are transmitted by isode ticks, and also known as blackleg ticks, deer tick, bear tick, plus other ticks. They go by different names depending on the region, like the Lone Star tick in Texas. Sometimes symptoms or clinical manifestations of ehrlichiosis and anaplasmosis are the same, each often characterized by sudden high fever, fatigue, muscle aches, and headaches. The disease can be mild or life-threatening. Several ill patients can have low blood count, low platelet count, anemia, elevated liver enzymes, kidney failure, and respiratory insufficiency. Older people or people with a suppressed immune system, again, are more likely to be hospitalized. Deaths have occurred. One challenge is that standard medical diagnosis is limited by the current ability to only test for 2 species. Ehrlichia parasites multiply inside host cells, forming large mulberry-shaped clusters called neuruli that doctors can sometimes see on blood smears, but the infection can easily be missed by standard medicine. Doctors may suspect ehrlichiosis, or also known as anaplasmosis, in patients who do not respond well to treatment for Lyme disease. The medical treatment for ehrlichiosis and anaplasmosis is the antibiotic doxycycline and rifampin in case of treatment failure. In resistant or complicated cases, combination antibiotic therapy is often applied. Whether effective or not, it is the only standard medical recourse. The U.S. National Library of Medicine and National Institutes of Health conclude that all or part of these bacterial infections we're discussing can come from one exposure. Example, one bite. Hence the primary meaning of co-infection. How many diseases can Lyme disease imitate? The CDC estimate that 300,000 new people are formally diagnosed with Lyme disease in the U.S. every year, and that number is growing. That's 1.5 times the number of women diagnosed with breast cancer. It's 6 times the number of people diagnosed with HIV or AIDS each year. However, because diagnosing Lyme can be very difficult medically, many people who actually have Lyme disease may be misdiagnosed with many other conditions. Most experts believe that the true number of cases is much, much higher. A simple checklist would look like this. Have you ever been bitten by a tick, flea, or even a mosquito, or has a family member? Have you ever had the following symptoms typical of late or chronic Lyme disease? Fatigue, joint pain, twitching, headaches, muscle aches, memory loss, cognitive impairment, sleep impairment, heart-related symptoms, gastrointestinal, including any stomach or digestive symptoms, neuropathy or any nerve pain, numbness, hot or cold sensations or tingling, psychiatric symptoms like personality changes, panic disorder, including depression, mood changes, or any related symptoms. What about symptoms of early Lyme disease, like red expanding skin rash, flu-like symptoms, facial nerve issues like Bell's palsy, muscle weakness or paralysis, fainting, shortness of breath, heart palpitations or chest pain like Lyme carditis, severe headaches and neck stiffness, shooting pains that may interfere with sleep, lightheadedness, pain and swelling in large joints, sudden stiffness or pain in joints, and the list goes on and on. But this is a simplified version to provide an idea of how Lyme and co-infections can easily be misinterpreted as many other ailments. Also remember that only up to 20% of confirmed cases have classic Lyme indicators, like the bullseye rash, and it can be transmitted by most any living infected host, including humans. If you have not seen it, you must watch our recent video on Lyme disease titled, "The Truth About Lyme Disease They Don't Want You to Know." You can find it on our website or on YouTube by the same title. What is the summary of this information that I hope to convey to you? In short, we offer hope and effective help for those seeking help from standardized medicine. If you have been infected with Lyme disease or any of its most common co-infections, according to the current data, it may take you years and up to an average of $60,000 to $200,000 to finally get an accurate diagnosis. Now, once diagnosed, they will start antibiotic treatments that medically have proven not to work for most people. Not to mention the destructive harm that antibiotics can cause to the health of your body, which you may need in the future to help in a possibly fatal ailment. If you look online medically for Lyme disease treatment, it looks simple and direct for a complete cure. This is far from the truth and should be illegal to mislead people in such a way. I've talked to so many people over the years who have lost family members or loved ones to Lyme disease or its co-infections after being treated medically for years. I have also worked with numerous people over the years diagnosed with Lyme disease with and without co-infections that have all completely recovered using non-invasive testing and natural treatments. I personally had Lyme disease almost 30 years ago and treated myself completely natural and experienced rapid recovery. What am I saying? I'm saying it killed the pathogens in the body, blood, and even inside blood cells. My only treatment was self-applied TKM therapy. Since that time, I have been involved in a case study with medical doctors, neurologists, and herbologists to treat severe cases of late-term Lyme disease and co-infections to determine the most effective natural course of action for complete recovery. I have learned much more since that time, almost 20 years ago. And at the King Institute, we have been blessed with resolving every single case to date. Of course, that means people that come to us start a personally designed recovery protocol and follow through. We now also have the technology to run an encompassing stress test to determine if Lyme disease or other co-infections are present and how much stress it's causing on your system. We actually test hundreds of possibilities in about an hour of time. This technology, when properly understood and used appropriately, has also provided a way to shorten the term of treatment. Plus, we test for options of treatment that will work best for the individual infected, not just what works best for the microbes. We also combine that with testing how the person will respond to any particular treatment. The technology available today is just amazing if you have it and know how to use it. We have also been able to determine for some people that thought they had Lyme disease or that it was suggested to them by multiple doctors, that after testing them, we found that they were not infected. That was good news. We did find the real problem and resolved it. We have provided help for people across the U.S. and other countries successfully and without any repercussions. For those able to travel to the King Institute, we will be more detailed in our testing and recovery regimen, although we are able to help those who are not able to come to us, if they are compliant and consistent with fairly simple and personally designed protocol after testing. This testing can be accomplished via fast-speed internet connection, a PC, not Apple, and by ordering a device to connect to your computer to help us assess you with an extraordinary piece of technology that was examined by the FDA and found to be the most effective galvanic response device on the market. We use this and your PC connection in order to assess you with our computer and software to run an extensive and very sensitive test on what specific pathogens are found and how much they are stressing your biological systems. Plus, what is the best course of action that your body will respond to effectively. This part of assessment is working with the most advanced frequency medicine available. We are able to perform specific tests because we have a library of frequencies of these pathogens. Plus, we have several ways to utilize this information. Specific frequencies called resonant frequency, which is the frequency at which an object, any object, animate or inanimate, naturally vibrates. One example is the main culprit behind Lyme disease, which is Borrelia burgdorferi bacteria. There is a mortal oscillatory rate that, once known and provided in an effective form, can cause the object to vibrate to the degree that it shatters. Similar to a wine glass that at a certain frequency will begin to vibrate violently, then shatter. Keep watching pathogens in the video as I continue. This only happens to the microscopic pathogens that are targeted, and nothing else is affected. In this way, it doesn't matter if the bacteria is in the blood or hiding inside blood cells and in the spine or the brain. It will be destroyed without harm to anything other than that particular object or pathogen. This is why we also include help for the lymphatic system and filtering systems of the body, as well as immune-enhancing protocol to ensure an encompassing recovery by making sure it is completely cleansed out of your body. Because so many people are plagued with these infections and cannot find proper help, and have often already spent a lot of money and end up not trusting that anyone can truly help them. I'm making it easier by offering a first-time testing discount of 50% off if you simply mention this video, plus $100 off each follow-through testing needed until you are free from these destructive pathogens. Just contact our office for prices and mention the discount from this video. You can call 214-731-9795 or email us tki@kinginstitute.org. From anywhere in the world. Don't forget to check out the video on Lyme disease titled "The Truth About Lyme Disease They Don't Want You to Know." Thank you for your time.